getting tested is very difficult, and you have to fit a certain criteria. There are people with COVID that are going to the ER, not being tested. The doctor turns around and says, well, you got the symptoms. You probably have it. Probably is not an answer. So they're adhering to the side of caution and telling the patient, go home, quarantine for 14 days. And the person might not even have it. He might just have a bad flu.
This remote ultrasound screening program is comprised of 3 individuals: the patient, the virtual trainer to guide the patient on how to properly use the ultrasound device, and the radiologist, also known as the overreader. You will need a portable ultrasound with remote access, a selection of transducers or probes, and a teleconferencing app to communicate with each other in real time. And lastly, you will need a diagram of the organs that you need to scan.
We sent him the system, we went through it, we gave him a diagram to follow along, and we actually utilized the Zoom function to actually see him scanning himself for a couple of trials or a couple of days when we did the scanning. The technology really with what we have today for both of us allows us to really harness the power of telemedicine. As we progressed with Sal from day one, obviously to the end, there was no changes in his lungs or his heart. We was looking for B lines to manifest from day one on with his positive COVID that he had, and realistically there was nothing that was showing up, even when Dr. Bart overread. Also, looking at his heart, we're looking to see depressed LV function. We're looking for possible clots or some. We're looking, in the heart. There was his LV function was normal. His RV function was normal as well. There was no RV enlargement. There was no gross, anomalies from a patient aspect. Was lucky. There was nothing. He had some mild, maybe body aching, and that was about it. He was, one of those model patients that you hope everyone would be like it when they contact the coronavirus.
This chest ultrasound screening was developed to detect any respiratory disorders or infections that may be related to the coronavirus. In the lungs, potential COVID symptoms are identified with the vertical B lines, demonstrating diseased lung tissue, where increased B lines indicate severity of infection.
When you do the lung ultrasound and you look for this ultrasound sign called B lines, they basically saw that the more B lines you had, it really was sort of prognostic. And so if they did a baseline exam, the worse your lung ultrasound score was, the higher risk you had of deterioration. And then on a follow-up scan, if they followed you up for any clinical reason, if your score worsened, you were much more likely to deteriorate.